there is a lot of overlap between OT and PT. I would say the biggest difference is physical therapy tends to focus on gross motor movement, so how the body is moving as a whole, how different parts of the body are affecting other parts, and occupational therapy tends to focus more on how the impairments or how movements are helping people do activities of their daily living. The end goal of physical therapy is going to really depend on the patient. It looks very different for every patient. So in early intervention, our end goal actually focuses a lot more on the family. It's helping the family determine what supports they need and how they can best care for their child and get their child to reach their full potential. So for some families, that might be getting their child caught up with at age level, participating in all the activities that their same age peers are. For some families, it may be teaching them how to position their child in a wheelchair or a gait trainer, and making sure that they're comfortable with that before they move on from our services. So when determining their child's overall development, parents should really monitor just those gross milestones, watching their child and seeing if they're rolling over, are they crawling, are they trying to pull to stand, and then are they doing those things in a way that looks to the parent like it would be natural? Is it how the parent would do it if they were to get on the floor and try to roll over or pull them up to stand, or does it look a little bit different? Some other things they want to look out for would be if you're getting your child dressed, are they feeling really tight? Are they pulling back against you when you're trying to put their arms through a shirt? Or on the flip side, are they not helping at all? Are they just are their limbs floppy and don't have much resistance when you hold them on their hip? Are they just kind of sagging into you, not supporting their own weight and holding their head up? And just really monitoring those types of things. So therapists are not able to diagnose developmental delays, but we are able to provide the family and the doctors with just observations that we have, things we're seeing, how the child's moving, if we feel any fluctuations in tone, and providing that information can sometimes help lead the doctors to a diagnosis. So an early intervention program, they're different all over the country, but for example, our early intervention program consists of physical therapists, occupational therapists, speech therapists, early intervention teachers, deaf and hard of hearing teachers, visual impairment teachers, and we go out into the home, and it's a lot of parent coaching based, so it's different from a clinical model where you may bring your child into a clinic and the therapist works one-on-one with your child on a variety of different activities. So we go into the home and really work with the parent on how they can best help their child. So showing them activities to do, to help their child crawl that they can incorporate throughout the day, or other areas that they may be having difficulty with the child at home. So we really focus on, it's a family-centered program. So all the goals and the services are created with the parent based on what the parent feels that they need. And it's hard because a lot of times kids are more resistant to working with their parents than they are with therapists. They know that they can get away with a little bit more. So again, for the parent, it's, I really push working things into their daily routine. So it's not for 10, 15 minutes, we're working on these exercises that the physical therapist told us we had to do. It's really all child-led and child-directed activities. So maybe your child is really interested in a puzzle today. And so we find a way to work on the activities we want with that puzzle. So for example, you said squatting was one that Karen had been working on in the past. So maybe we have the puzzle up on the couch and we're knocking the pieces down on the floor where he has to squat down to pick them up and put them back in. So really taking whatever activity the child is interested in doing at that time and trying to make it work for whatever activity you're trying to get out of it. During our home-based physical therapy sessions, we have the parent or the caregiver, whoever's there, actually get down on the floor with us and do the activities. So I might demonstrate the activity that I'm shooting for, and then I have the parent do it to make sure that they're able to do it correctly and they're getting the results that we want. And so it is critical that the parents kind of incorporate those activities throughout the week. We see the most progress when activities and exercises are repeated throughout the week instead of with us maybe just 1 hour a week or half an hour a week maybe even. So kids make a lot more gains when those exercises are worked into, again, their daily routine. So for parents who are at work throughout the day or they're busy, it may be communicating their goals to the daycare provider that the child is with. Or if there's some things that they can incorporate into their morning routine when they're getting the child dressed and ready for school, or when they get home from work. If it's dinner time, maybe having the child help depending on what activities they're working on by stepping up on a stool and off of a stool to get to the counter to help prep things. So really working it into whatever activities that they're already doing with the child. So determining discharge from physical therapy looks, again, very different for every client, and it depends on the setting that you're in. So what might be a discharge for like an outpatient clinic may be very different from what early intervention would look like. So for some kiddos who are higher level, discharge from physical therapy may be that they're able to perform all the tasks that their age level peers can do, and they're able to do so in a way that's efficient and isn't hard on their body. For some other kiddos, it may be that their progress has kind of plateaued and we're not seeing any gains over a couple months in therapy. And so the parents may make the decision that they feel like they have enough knowledge to help their child either stay at where they're at or continue to progress a little bit. And so we may decrease to maybe monthly check-ins or quarterly check-ins to see if the child has made any progress or if there's things that we can add to help them continue their progress. I think the best place to start if a parent has concerns is always going to their pediatrician, bringing up their concerns and asking for referral to physical therapy. Here in California, parents can, I believe, give themselves a direct referral to the regional center to perform an evaluation. There are some physical therapies that will accept private pay for pediatrics as well. So if they don't, aren't able to get a referral from their doctor, or the doctor is giving them, as you mentioned, the let's wait and see, they can either not refer themselves, but private pay directly with a physical therapist or refer themselves to an early intervention program. The biggest thing I would add is knowing that you are your child's biggest advocate. So if you feel like something's off, something's not quite right, don't be afraid to voice your concerns or give a little pushback if you don't feel like you're getting what you need. And then also, if something's not working, if we're working on something in therapy and you go home and it is not working for you, it's not working for your child, it's causing tantrums, it's causing meltdowns, don't be afraid to let us know. Come back and say the next time, hey, is there a different way we can do this? Can we try it a different way? Is there a different activity that will give us the same results? Because we want your child to succeed, and every program needs to be very tailored to the individual child. So if something's not working, we want to know, and we want to be able to work with you to make sure your child's getting what they need and that they're going to progress.